Really pleased, and I think this is a great sign of the benefit we get from Professor Beale being our chief nurse and head of governance. This is her initiative, and one of the things that she's brought with her for us to launch this year. So I'm very grateful to you, Juliet. Thank you very much. Now, Vicky's been away and she's trained. She's a trained trainer, and so she's going to share the benefit of that with everyone as we go through the various initiatives that she'll explain to you. At the essence of all of this is continuous improvement, and this is something that we really want to push, not just in relation to patient safety and the care that we do, but in everything that we do. So I implore all of you to think about that every day. But thank you again very much for joining us. And if I could hand over to Juliet, who will explain a bit more about what happens next. Thank you.
Okay, thank you very much, Mark, and thank you for your kind words. But this isn't about me. This is about everybody who works in health and social care and the difference that each of us as individuals can make. So most of you will know that I've had a reason to actually experience healthcare in Guernsey, and I have to say my experience of healthcare here has been absolutely phenomenal, and I just want to take this opportunity to thank everybody who looked after me, because I am making a recovery. I'm not quite back at work yet, but I really wanted to be here today because I'm really passionate about Safer Every Day. So what is Safer Every Day? It started off in the United States at the Institute of Health Improvement, where Don Berwick thought that if health clinicians, and it was health clinicians, but I'll talk a bit about social care too, followed certain methodologies that they could improve care for people and that they could measure that. And they went on to launch a campaign across the States called 100,000 Lives. That progressed on to 1 million lives, and it's now 100 million lives globally. Now that sounds huge, and it sounds as if it's sort of very strategic and out there somewhere. But they have really good ways of measuring, they have fantastic methodology, and they can actually look that they make a difference to the outcomes for people. So both that they stop people dying unnecessarily, but also they improve people's health outcomes too, and people live a better life. There are other places that have really taken that on. So the Wales 1,000 Lives campaign has been going for some time and has made huge differences to the way that some healthcare is delivered in Wales. There are all sorts of other examples. The good thing about this is that you can actually look at the methodologies, look at your healthcare system, and make sure that your methodologies and what you're doing fits where you're working. So fits Guernsey, fits the environment that we're working in Guernsey, and not only fits the health environment, but our social care environment as well. We're one organisation. I would ask that people from social care bear with us a bit more, because the work done in social care is not as advanced as the work done in health. But I truly believe that the methodologies can be replicated in social care so that we can look to see how we're making a difference to the people of Guernsey across the board. The other great thing about this, and Vicky will start to illustrate this, is that it's not about what an organisation is doing, although we have got the campaign and the leadership of this organisation is absolutely behind this campaign. It's about what each of you do as leaders in your own area and clinicians in your own area to make a difference. What are those small cycles of change that you're going to do and make that actually makes a really big difference to the people we care for in social care and in health? And that's what's really important about this. So what we want to do is work with you to make sure that the things that we're doing are right for your area that you work in, right for Guernsey, and that we can measure it. Because whilst I know that actually we deliver some absolutely fantastic healthcare, we don't always measure and benchmark it as well as we could. Some areas we do, but I think we could do this better, and we need to keep looking at what we're doing. So that's why it's called Safer Every Day. It's about continuous improvement. So Vicky's here to launch this today. As Mark said, she got sent off to Boston. I know she had a fantastic time, and I'm sure she's talked to many of you about it. But Vicky signed up now for 3 years to deliver the Safer Everyday campaign. So whilst we're going to have a really big concentration in 2018 on Safer Everyday, we're not going to suddenly get to 2019 and suddenly there's no Safer Everyday. We want this to be really embedded into the DNA of the organisation. So thank you for coming and thank you for your commitment. The other thing I think is really important to understand is this is not another initiative that's tacked onto everything else that we've been talking about. This is part of the Care Values Framework, part of Principle 2 around safer care and delivering safer care. This is part of our new operating model. It's part of thinking differently and working differently. It is a pillar that absolutely underpins everything we want to do and want to deliver in Guernsey and for health and social care. So I'm going to hand over to Vicky now. So thank you very much for coming to the launch today. And I will be back in about March properly, and I really look forward to working with you all then. Thank you.
So thank you for coming. It's nice to see you all. And I'm going to introduce to you firstly the framework that was devised by the IHI, the Institute of Healthcare Improvement. Some of you, I know, I can see the faces, have seen this before, but I think it's really important that I just start with this because it will give you an idea of what it's about and how we go about ensuring safer care. So, in order to ensure safe care, we need to be psychologically safe. People need to feel able to raise concerns and to call out when things aren't right about patient safety, no matter what role they place in our organisations as a whole. We also need to be accountable. A lot of us are accountable practitioners. We have registrant bodies. So we need to work within our own accountability, within our own scope of practice, but we also need to recognise that there are times when system flaws fail. And so what we need to do is ensure that our systems are robust enough to ensure that we ensure accountability across all areas. One of the biggest things that will come as no shock, communication and teamwork. It's really important that we take this premise and work on how we communicate with people, how we play as team players. And it's really important because we cannot do it on our own. We rely on so many different people to deliver healthcare. And it's really important within teamwork and communication that we negotiate. So that's not just negotiate with staff amongst ourselves and make a plan that is pleasing and appeasing to everybody, but primarily with our patients and our service users. Juliet's already alluded that perhaps we're not so great at actually how we go about demonstrating our improvement and measurement. So something I think we're going to work on this year is definitely using the methodology that I was taught and how we identify how we're going to get from here to here and how do we show that through the journey throughout 2018. Continuous learning, I missed that one on there, so apologies for that. But continuous learning, we know that when things haven't gone right, we want to learn from it. But we also have a great opportunity when things have gone really well. Let's take that opportunity to think, how do I replicate that? How do I use this again in my everyday care and support that I provide to people? Also important to think about the near misses. So when we've just gone, phew, thank goodness for that, didn't go wrong. What do we do about that? How do we learn? Instead of just moving on and getting on with our daily work, how do we use that as an opportunity to improve patient safety? Reliability, it's really important that we try to standardise where we can to avoid those variabilities that happen amongst people because we are all slightly different. But it's really important we standardise where we can but accommodate when things aren't possible. So we have different clientele who perhaps by sticking a tool that captures how they'll deteriorate may not work in certain settings, and we need to be able to adapt accordingly. It's really important. I know HSC has made a massive leaps within this area about wanting to be open and transparent. If we're open and transparent, we'll build up a culture that ensures a safer environment for people, and those that have our services, who use our services, will feel that we're not trying to keep things from them, that our goal is to deliver healthcare in a way that is open and transparent. And as already mentioned both by Mark and Juliet, the leadership is a key part of this. The whole of HSC and wider healthcare providers have signed up to this. as being the way forward to deliver healthcare, the way forward to show improvement, and that is absolutely key. Right at the very centre of it is our patient themselves and also their family members. It's really important that we use them in this whole process, because if they understand our expectation, or we understand their expectations, they understand what we can deliver, we will deliver safer care. So that's really important. It's on a poster, which is really helpful, I hope, for you. And I hope you'll take one of those posters or several of those posters into your areas and share them with your colleagues. Perhaps a few statistics. Hopefully it won't be too scary, but it is really important, and this is why we're doing it. It's estimated in the UK alone that there is a harm reported in an incident every 35 seconds. Interestingly, though, in saying that, some statistics say that actually people are only reporting about 14%, which then maybe puts that into a bit of context. And according to a study in the States recently, it's the third leading cause of death is a patient harm in a hospital across over the last couple of years. And it's quite alarming, the level of patient safety incidents. Interestingly as well, a bit anecdotal I suppose in that respect, but to say that healthcare patient safety incidents are the equivalent of a jumbo jet falling from the sky, fully loaded with people every single day. That is a little bit scary, because you don't hear about that, or when we do, it's quite rare. But imagine that in healthcare every single day. What we do is very, very risky business. We've already said it's launched by us, but it absolutely requires a consistent approach and a teamwork approach from everyone who's delivering healthcare. It's about quality improvement, and it's patient safety driven, totally about the patient and how we deliver safer care. And by doing the methodology that Juliet's alluded to, by using tried and tested, robust, small tests of change, we will see improvements, without a doubt. There is no doubt we will not fail if we adopt this method. Now, who's it for? Well, it's quite obviously for the patients, it's quite obviously for our bailiwick, and that actually includes you, does it not? Because I'm sure, as Juliet's already said, that she's also received healthcare in Guernsey. What we want to do is make sure that we receive we spread out a multi-agency approach to this. This is not HSC alone. We cannot do it alone, and we need the GPs, we need MSG, we need the nursing homes, we need anybody and everybody delivering health and social care to adopt this, to take it on, to think about what they're doing and how they can improve on that. And again, why do we want to do it? We want to support you all. So that my role is to lead. I'll never manage to do it without you, but my role is to lead you, to help you get to those real aims and objectives, to use the methodology robustly, to help you show the improvements that you've put in place. And that goes across all areas. So I've met with a few, and I need to work a bit more on reaching out to some areas like the dentist. I haven't quite managed to do that quite so well. So that's an area for me that I've got to work on, an area I recognise that I need to reach out to. And it's a great opportunity. We came to work in the health and social care provision because we wanted to do a good job. We wanted to support people. None of us come to work to do things wrong. And it's really important that we focus on that actually we came to deliver good care. And here's our opportunity that allows you potentially to go, I think we could do something differently. Or why aren't we trying this? Well, under Safer Every Day, you have the permission to do that. You have the permission to think about doing things slightly differently, to think about the things that you do that aren't working and say, I want to stop that and let's do something different. Let's do it. And ultimately, it's the right thing to do. We should be doing it the right time, every time. So here's just a few examples of some of the things that are already going on, not necessarily under Safer Every Day. They started potentially before that. But again, they show some of the work that we're doing that shows development and improvement in safety. Human factors. I mentioned this previously in other sessions about how human factors are a big concern for delivery of patient safety to ensure safe care. If you think about it, we as humans, we're not robots, thankfully, I have to say, and we will fail. And it's really important that our systems and processes are robust so that we reduce the risk of us doing that. So human factors, Mary Carre at the side of it, Mary is sending one of her team away to do some training in the next couple of weeks. They're going to look at how they'll end up being proactive to see that the care that we deliver in a proactive way rather than just being responsive when things go wrong. They'll consider more how teamwork is essential in order that we reduce the risk of human factors. So knowing how your team is feeling, knowing if someone's had a really bad night or a difficult conversation's got to take place and their mind might be elsewhere, knowing that all those risks are there to being able to deliver safe patient care. So that's one aspect that we've already started. We've also working on the Falls Bundle pathway, which most of you from HSC will be familiar with. And Jill Yeaman and the team, to be fair, not just Jill, but a workforce and a working group got together and they have devised the bundle working on that. And actually, I think it's April, we're going to show how far we've come already, because we recognised within HSC that we had a large number of falls within our care, and that was a change that we needed to make. Likewise, Gary, VTE and the VTE checklist, he and the teams, as a result actually from an adverse event showing learning, as was the falls as well, that we needed to make some changes that was in line with NICE guidance. And so we've devised a new policy and a new checklist, and that's operational now. And as with everything, sometimes it's not always easy to embed, and we have to see if we have to change that. These are the small tests of change that we need to do. But we're working on those. And then we've just recently introduced excellence reporting, a means and a way of reporting when things have gone really well. When somebody has either stepped up or just gone the extra mile maybe, or maybe just a situation has gone extremely well and you want to say, thanks to Marie for her effort in this particular case. That's really important that we think about how we safeguard ourselves for patient safety, because without you, there is no delivery of care. And it's really important that we look after each other. And how do we go about that? One of the things that we've got planned coming in the year is how do we improve our culture, change our culture so that we feel better, so that staff feel valued more, so that they feel healthier. And then we're going to look at how we improve those outcomes with leadership, as that is a key crux to delivering care. I don't really need to go through this slide because Juliet's kindly done it by raising the fact that it aligns with so many things that we're already doing. It's not a new initiative that we tag on the end, it's already there. It's about embedding things and working in such a way, or giving you the freedom to work in a way that says, this isn't working, let's change it. And some of that I think is really important, because I think sometimes we get stuck and we know things aren't working, but we don't feel necessarily that we've got the permission to change things. Well, you do. Under Safer Every Day, you can change it if it's about patient outcomes. Ultimately, we need you. We need you to deliver this. This is your venture as much as it is mine to help lead you. I cannot do it alone. It would fail at the first hurdle, and I can't do it actually. I'm going to have to say a thank you, because without the two people in the corner here, you wouldn't have had these posters, nor the presentation looking as good as it does. So, it's all about trying to make things safe. And by helping me with this, it means that it's taken a bit of pressure off me. And so I'm appreciative of the communications team from the States of Guernsey. But we're all working together to improve the outcomes. So if there's something that you would like to join in with, these are the things that we've already established are going to go forward this year. But there's areas there that aren't represented. I don't want to point any out particularly, but there are areas there that haven't got anything that they're showing that's really good. And I know there's good work out there. So let's find a time, find a month, join in. Let's slot on the... all right, we won't necessarily change the poster, but we can add more in, shall we say. So hence my email address there. That is not an absolute given. I want more. I want more from you. Let's showcase what you're doing, and I really would like some representation from outside of HSC and MSG so that we can see the good work. We don't get to see a lot of what goes on outside from GPs or the nursing homes and things like that. It'd be really good, wouldn't it, to share how they've learnt, how they've managed to make some improvements, and share that learning so that we can avoid errors happening in other areas.